dedicated physician assistants at GoHealth Urgent Care, each bringing a wealth of experience, passion, and leadership to their roles. Lyndsie serves as a director, collaborating closely with multidisciplinary teams to deliver high-quality care. Erin serves as the clinical manager of virtual care, overseeing telehealth and results management. Both of these heavy-hitting women are moms and genuinely innovating when it comes to building community. Welcome to DX the podcast, Lyndsie and Erin.
Thanks for having us.
Yes, we are so excited to have both of you. Honestly, when I look at the two of you sitting here, it is just striking how much you actually represent collectively, right? So we're going to try to get into as much as we can today. But I believe it's important to start with one of your foundational commonalities, which is that you are both PAs. So talk us through the perception of PAs in urgent care and how you've collectively navigated maybe the national healthcare landscape, maybe some organizational dynamics. Kind of walk us through that and what that's looked like for you over the years.
Yeah, so I think like the urgent care industry in general, right? I think we've kind of fought a little bit of an uphill battle. I think for years it was sort of viewed as maybe lesser skilled clinicians. And, you know, I think especially through the pandemic, we really showed not only how important we are to the communities that we serve, but that the clinicians that are working in urgent care are highly skilled, really, really unique providers. And so that, you know, just that journey has been really nice to be part of. And then definitely as a PA, I think we're fighting our own set of battles.
For sure. I mean, in urgent care in general, like Lyndsie mentioned, I think there was always that trope of like the doc in a box, right? That somehow urgent care was a lesser quality than going to see your primary care doctor or to the emergency room. And so, you know, people already are a little bit unfamiliar with the idea of a PA, a little bit more comfortable with the idea of a nurse practitioner, but still similar in that we're not that physician role. And so I think it just kind of accentuated between the PAs and NPs in the urgent care industry that we really wanted to make sure that we were representing high quality care.
So what were some of those steps that you all decided to take? You're like, we need to make some changes here in this space, and we are ready and willing. So interesting, too, that you're not necessarily from the same area. Like, you kind of started to collaborate over time just based on your common interests. So tell me a little bit about that journey.
So Erin and I have had quite the journey. So we live on completely opposite ends of our market, right? Like, we probably would never have organically come together. And through the luck of, you know, both ending up in a leadership position and kind of having the opportunity to work together, we've become, you know, not just like work friends, but like really good actual friends. And it's been so great because I think that, you know, we see each other in such an amazing light, and we can sort of be that cheerleader for each other when you're struggling a little bit, feeling it yourself, especially coming into leadership.
I mean, one of the very first projects that Lyndsie and I worked on together was this, we called it bootcamp program, right? And it was through the pandemic, we needed providers. We needed to fill our centers. It was just, there was unprecedented volume, right? And so we were looking at bringing in a lot of new providers very quickly, and that meant that we were bringing in new grads, right? Nurse practitioners and PAs. And so we were kind of tasked together with creating a program on how to bring these people up to speed really quickly. And so in the first few stages of that, we called it this, it was kind of an unofficial program, and we called them our boot campers, our little baby boot campers. I'll never forget that first round.
We learned a lot of hard lessons.
Lots of hard lessons. But actually, Lyndsie has now turned that into a great, successful, full-on fellowship.
It's been really exciting to kind of see it grow. And I think that's something that we learned, especially in the urgent care space, and making sure that you have these people that are highly skilled in delivering high quality care, is sort of creating the standards of which we're going to teach them how to do that. And not everyone comes out of school fresh and ready to jump into, of all things, the beast of urgent care, right? And also, I think that having particularly PAs and NPs have this, you know, additional really curated education and kind of additional training makes other people see that they really are highly skilled and are qualified to take care of the patients in our communities.
And it's a huge need, right? Like not just in urgent care alone, but the growth of nurse practitioners and PAs supporting healthcare across the entire country, across every specialty. It's an absolute necessity, no matter what space we're in, but especially in urgent care. When patients are walking in, you've never met them before, you oftentimes don't have much history on them. You're playing Sherlock Holmes, right? You're putting your hat on and trying to figure everything everything out while also kind of balancing the education that you've, got in your back pocket and then trying to put those tools together. So having that extra layer of support is a phenomenal approach to making sure that the providers seeing patients at urgent care are the best possible providers that those patients can be seeing.
And the need is there, right? Yeah. I mean, we have so many people that need healthcare, right? Like we don't have enough of us to go around. Right. And so when people want to join the urgent care space but don't have the experience behind them to jump in, it's nice to have programs like that or have some recommendations from organizations like the UCA or the CUCM to say these are the things you need to be really good at to do this well so that we can be prepared.
And the quality metrics, right? What are you monitoring? What is the standard that you're setting at your organization? I mean, I know that at GoHealth, we really focus on antibiotic stewardship. We are outperforming a lot of our other colleagues, right? In like primary care and emergency room medicine. Our antibiotic stewardship numbers in our market, I can speak for, we're below 4%. That's like unheard of in any industry, let alone urgent care. So I think we're doing baby steps, right? But we've made a lot of movement there on reversing that view on urgent care and quality. And I think right now I could confidently say, at least at our organization, like I'm really confident about the level of quality that we're giving. And I think a lot of that is in part to the work that we've done.
That's great. And sometimes I know we talked a little bit even before the podcast about some of those really discrete and clear kind of directionary things that you can provide to new graduates, let alone any provider. So specifically, you've talked about the impact and art of holding clear conversations. So I wanted to talk about that a little bit. So sometimes this is with our colleagues, right? This might be with a fellow healthcare provider, but especially with our patients, so that those few moments we have with them for them to truly engage and trust us. So tell me a little bit about kind of the framework or maybe some of the training that you've suggested over the years, or maybe it's formal, right? So whatever it may be, what that looks like and maybe a little bit of an example of what we might hear.
So first and foremost, you get one chance at a first impression, right? That's it.
So it's called a first impression.
First chance.
And so not to put too much pressure on, but you really want to nail it that first time. And I think confidence is just so important. It doesn't matter what you say if you don't enter that exam room to your patient or that meeting with your colleagues with confidence. People aren't going to believe or trust in what you're saying, right? So I think that's number one, is supporting the people around you enough that they feel confident. They know their worth. And they know that they've got people cheering for them, right? And they know how much people think of them and what they're capable of doing. So that's number one. And that's kind of a common theme, I think, of me and Lyndsie's leadership style.
And I was going to say, kind of some examples, right? Like Erin had said, being super confident when you're coming in, whether you're talking to a patient or talking to a colleague, especially as people in leadership, you sometimes have to have those hard conversations. And I think, when it comes to the patient or colleague, tying it back to goal is always really important. So an example, when I talk to my patient, I'll tell them, listen, I want you to feel better. My goal is to get you to feel better. I want you to leave here with a clear plan that you feel good about, and you're going to feel better in a few days. And if not, this is what we're going to do about it. This is what you can reach out. You can call me. We can figure it out. And I sort of do that, I think, and Erin, I'm sure as well, when we're also working with maybe a provider that's struggling, to say, what's our goal here? Our goal is to get our patients better, but do it in a safe way that's not going to harm them, to make sure that they understand the plan. So you can kind of look at it from both perspectives, but always tying it back to what is our goal. And realistically, if you can all sort of align on the goal, it's really easy to get the buy-in from the other person you're having that conversation with, because it's really hard to kind of argue, like, what do you mean you don't want your patient to feel better? Like, of course we do. And now we can all agree and let's come up with a plan to get there. So I think that that's just a really good tactic and a good kind of communication tool to sort of to get that point across.
And that connection is so key. It was, I heard a couple variations, but at the end of the day, it's what is our collective goal, right? And that's what really drives it home for that patient or that colleague that you're connecting with.
And especially for the colleague, right? Like, now they know I'm on your team. I'm doing this with you. You're not alone in it.
I want to see you succeed.
Exactly. And same for the patient. You're not alone here. If you don't feel better in a couple days, this is how you find me, and giving them that option.
That's really great. Showing empathy too, I think, is important, right? So I think it's easy for that relationship between provider and patient to be like one-sided,
transactional.
Right? Yeah, and don't get me wrong, we all need to stay professional, but I think kind of reminding the patient that you're also a person, right? That you have empathy, and yes, it's my job as a healthcare worker to make you feel better.
Yeah.
But I'm also somebody who I want you to feel better. That's just who I am as a person.
Yes.
And I'll sometimes say that, right? If we all struggle with antibiotics,
Yeah.
right? It's so common in urgent care.
Industry-wide.
Yes.
Everybody wants an antibiotic.
Yes.
It's gotten a little bit better over the last couple of years, but still a major struggle. And so if I'm having a conversation with a patient, who comes in with that, like they think they have a sinus infection, for example, they've only been sick for 2 days, right? And we know they don't need that antibiotic. If I can sense that I'm not getting that buy-in from the patient, I'll just kind of take a step back and say, you know what? It's my job to make you feel better, but I do actually want you to feel better. And I truly believe that an antibiotic is going to make you feel worse,
Right.
I don't want you to also have diarrhea on top of your cough.
Right.
That might get messy.
That would be a problem. That would be tough.
And I'll sometimes bring like that personal connection of if I were the patient or if you were my sister, I would not want the provider to give you an antibiotic. And I think it really just like makes that connection and drives home the point that you really do care about them. And now they're really listening to you and they're more invested in what you have to say.
Right. So it goes a little bit beyond scripting, but then also reading the room,
Yes.
reading the patient response, finding
Absolutely.
the best way to connect with them. That's great. So just shifting slightly, but almost kind of in the same vein, talking about just women in healthcare in general, especially women in healthcare leadership. So you two are living, breathing examples of this,
Yes.
of course. I just want to hear your point of view on like, where is the world at on women in leadership, women in healthcare? Let's kind of talk through that.
Yeah, this is something that's really near and dear to my heart. It's kind of a passion project of mine. I mean, women make up 75% of the healthcare workforce, but only 25% of the healthcare executives. Something's wrong there.
That's just
Yeah. So I think, women in general, like we're great leaders naturally.
Yeah.
We lead our families. We lead our children, right, to become the humans that we want them to become. It's kind of built into our DNA. And so it's interesting that we haven't always had that role historically. And yeah, it's gotten better over the last few decades, but there's still a lot of work that needs to be done.
Yeah.
And I think, Erin and I would say we're lucky in the sense that we're also part of an organization that does kind of have that really good example of women in leadership, right? Like our CMO is a woman, our COO is a woman. We have fellow, female colleagues that are in leadership.
50% of our team.
Yeah. So it's
Oh,
really
wow.
nice
Team
to
are
see
women.
that, it is something that's supported, and I think a lot of it is you need to sort of see that example to know you can do it.
Sure.
And also so important, and I think Erin and I are both definitely those like girls that we really want to get to the table and then bring someone with us and make room for everyone and show them like, look, you can do this. You don't have to be a man, or you don't have to be, you can do this. You can be a high level leader regardless of who you are, what the title you have after your name is. You can really get there. But I will say, I don't think I would be in the position I've gotten to at this point and had the success, luckily and very gratefully in my career without having someone next to me like Erin, having that person that can kind of tell you when you're not feeling it on the inside that you're crushing it. Or, you can have that meeting where you're like, oh my gosh, I think I blew that. And just having someone be your cheerleader, be your kind of work cheer bestie that kind of tells you like, no, like from the outside, no matter what it's feeling like on the inside, you seem like you've really got it together.
It's great.
Which is so good to hear when you know on the inside, you're like, but I don't.
Right. We're all our hardest critics.
Oh, 100%.
I can tell a story too that really exemplifies this. And so Lyndsie and I have really lived mirrored lives. It's really bizarre that we've come to find each other at work. But so we are around the same age. We've been PAs for about the same amount of time. We became moms at about the same time. We became leaders at about the same time. And so Lyndsie and I both, our first step into leadership was the lead PA role. And we started it about the same time.
Oh, wow.
So she had a baby, came back from maternity leave as I was exiting. Literally,
We were like ships.
my last day was a Friday. Her first day back was that next Monday. And so by the time I came back from maternity leave, it was my second. And I thought, I did this the first time around. I'll be fine.
Easy
like,
peasy.
I can work. I can be a mom. I can do it all.
Yeah.
I could not do it all.
Yeah.
It was so much harder with a second in the mix and a new job of being a leader, right? With all of that extra responsibility piled on. And so I was so lucky to have Lyndsie. And I remember connecting with her on one of our first calls when I came back. It was just a couple weeks after I'd come back from that maternity leave. And I was really struggling. And I was open and honest with her. You know, I think it's easy for us, especially as women, to kind of fill that expectation that like, we're just going to kind of fake it till we make it. Don't let anybody know you're struggling. But I felt a connection with Lyndsie, and I was honest. And I said, you know, I have to be honest, I'm really having a hard time balancing all of this. And Lyndsie on that call broke down in tears.
I was like, I don't know how I thought I could do this. Like, and you're doing it with 2, I can't even do it with 1.
Right. But she was like, I'm feeling exactly the same way. And so during that conversation, I realized I'm sure we are not the only women feeling this way.
Right.
And so then I created a team member resource group, basically a support group for working moms in our organization. And it's been
amazing.
Yeah.
I mean, Erin is underplaying it. Like, it is such an amazing resource. It's wild to see how many women, and honestly, there's even some dads too that are in there. So it's not just, working moms, but just kind of showing, each other, I'm really struggling with this, or sharing our wins, or sharing our hacks to make it through the day. It's an amazing resource, and just proof that being vulnerable with each other and being honest with each other and not having to put on that, like, fake it till you make it, like, I've got it, I can handle everything. Because I think, especially as women, I think we're sort of taught to, like, do it all. You have to do it all. If you want to be successful, you have to do it all. And I think we're learning, like, it's okay to tell each other, like, I'm not okay. Can you help me?
Yeah, for sure. And so those are obviously some barriers and some difficulties that women have to overcome in the world of healthcare. But what are some of the great successes that women bring to healthcare? Tell me about your perspective on that, be it, the way that we're wired, the way that, our fabric is knit as a woman, and kind of what we bring to healthcare.
I mean, we're natural nurturers, right? We want to take care of people around us. It's, again, part of our DNA. And so it's like we're pouring every part of ourselves out to our families at home, no matter what makeup that family is at home. And then we go to work, and especially, again, as healthcare workers, we're pouring ourselves into our patients, trying our best to make them feel comfortable and like they're being cared for. And it's, it's great for us as women that we have that, right? Yeah. But it can also be, it's kind of a double-edged sword, because you're giving at home, you're giving at work, and it's so easy to give all of yourself and not have anything left for yourself in the end.
I think something that I've been so happy to see, and I'm sure you've seen similar, in a lot of the organizations that I've become, interested in and jumped in and joined into and kind of slowly jumping into, more and more groups, I'm noticing over time, I'm seeing more women. I'm seeing more PAs. I'm seeing more kind of different groups of people with different backgrounds. And I think that can only make us better. Having one voice and one opinion is never really good for any organization. So I think that I've just been so happy to see over the course of the last few years that I've, put myself in these spaces, that there are more people like me in those spaces, which is really nice.
It's great. And some of the things you've talked about just kind of generally and briefly, but I was curious if you'd be able to tell some of our listeners, like, some of the specific ways that women or anybody really can find the resources we talked about. So some of the support, the boot camp kind of perspective, tell us a little bit more about that.
Sure. So I think the Urgent Care Association is a really great resource for a lot of us in the industry, as well as the work that the College of Urgent Care Medicine is doing with regards to a lot of the education and the standards and trying to raise that quality, and really define urgent care as a true specialty. And I know Erin, she doesn't always toot her horn. We love to toot each other's horns.
There you go.
But Erin has been doing amazing work, and I'll let you talk about it. But there's another organization called PAs for Women Empowerment that she has dragged me into as well. I love it so much.
I tell everybody about it. It's a really special group. It's an official caucus of the AAPA nonprofit organization, and it's called PAs for Women's Empowerment. And it's all made up of, actually, we take male members too. Any gender identity is welcome. But the organization really is focused on empowering women to be their best selves, to excel where they want to excel, wherever that is, in leadership or at home. And it's just bringing resources to women, particularly PAs, to really grow their professional growth, right? Their how do you balance everything? It's CMEs, it's mentoring, so many things.
And so really tangible next steps for anybody interested in looking for a next step. Okay.
Exactly.
I sort of look at it as like, if you don't have in your organization your own personal like work cheerleader,
your own personal Lyndsie
bestie
or
person, organizations like that are full of them. It's these women that like sometimes you don't even know that are cheering you on, which is so wonderful to have.
Really great. It's awesome. All right. Well, it's been really great. I thoroughly enjoyed everything that you all had to talk about today. So at this point, as we're kind of getting ready to close the podcast here, I'd love to hear what some of your near-term goals are. So it might be personally, it might be professionally. It's just really inspiring to hear all the work that you've done and what you've been passionate about. And so whatever you want to relay to the listeners, maybe it's a fellow PA, maybe it's an exec that's listening. What are you looking forward to next, or what are you striving for?
I'll start. So I have been, again, so grateful and lucky to sort of have done a lot of things in a short period of time. Over the course of the last few years, I've had a decent amount of career growth. And it's funny, and it feels like a little vulnerable to say it, but part of me is sort of okay with maybe pausing for a second, sort of settling into where I am.
Sure.
I think I've had a lot of change and a lot of growth, and I think that I really, really want to get really good at what I'm currently in and sort of grow in the space I'm in, not necessarily always looking to get to that next step and the next step and the next step, and kind of settle in for a minute and kind of hone in my skills where I am. And I think that kind of reflects, like, sometimes you don't have to be looking for the next step up or the next position. It's also a very valuable goal to have, to just get really, really good where you are, really sharpen the team around you and kind of build the team around you, and then that kind of guides you on your next steps. And to be honest, could be something that you're not even expecting.
Oh,
and
absolutely.
It just kind of comes along, and you're ready for it when it comes. So that's sort of where I'm
at.
Love
that.
Very insightful.
Yeah, I love that. I would say, so I just stepped into this new role as the clinical manager of the virtual care team, and I'm really focusing right now on how to optimize our virtual care, right? So both our telehealth visits that happen in real time and the asynchronous results management, learning like how can we bring on new AI tools, for example, like lean into all the technology that's really available right now. And so my next step to focus on is really streamlining the services that we offer there. How can we make it run more efficiently, and really expand from there? What else can we do virtually?
That's great. It's so exciting to have a new role and just think about what could happen.
Reignite
next.
the passion there. Yeah.
Well, it was wonderful to have both of you. Thank you so much for joining.
Thank
we
you.
look forward to
so
probably
fun.
talking to you again sometime.
Yeah, please, anytime.
Yes, until next time on DX the Podcast.
All right. Thanks so much.
Thank you. DX the Podcast was born out of the idea that we are ready to diagnose the future of urgent care with the smartest leaders in the industry. Find all the other episodes on Spotify and LinkedIn to keep up with us in this journey.